So I could say that we find ourselves in an unprecedented moment. But when an increasingly authoritarian government and their out-of-control billionaire buddies are threatening all working people, it would be more true to say that we are in a war, a class war. What we know as union workers is that in this class war, it takes dedicated, militant movement to fight back. I could not be more proud to know that that movement is right here in this room. When the Labor for Democracy Coalition launched earlier this year to demand an end to the Trump administration's assault on the right to organize and bargain, on immigrant workers, on freedom of speech, on public health, science, truth, and democracy itself, it was no surprise that our unions joined together on the coalition's leadership committee. UE and NNU, as Carl mentioned, have always known which side of the class war we are on. And we have shared a long tradition of refusing to believe that labor management partnerships ever benefit the working people. Our approach to organizing, growing our unions, and building the labor movement is rooted in the class struggle. And you'll never catch us partnering with the bosses in workplace or our society. UE has always stood with the nurses, and we stand with you. And you know, we are right now, we are all on the right side of history. There's no sugarcoating what we are up against. I think we can all agree on that. Everything is at stake. But let's talk about how we are not just fighting back, but also keeping our momentum moving forward, especially when it comes to this administration's attacks on healthcare. What nurses see right now is a takeaway campaign on steroids, mixed with a massive restructuring program. You all are no strangers to that. Victories that we've already won, benefits that we already have, funding that's already been dedicated to public health. This current administration is taking an axe to it all. But gutting Medicaid and other health programs, their insanely bad billionaire bill will ultimately strip health insurance coverage from 13.7 million people. Critical community hospitals across the country, especially in underserved rural areas, now also face closure, as our sister just mentioned earlier. This is beyond appalling, given that the Medicaid cuts were instituted to increase funding for ICE and to pour billions into the corporations making money off of kidnapping, detention, and deportation of our community members. And that's right, boo. And these cuts from both Medicaid and food programs for the poor siphon money from the most vulnerable in our communities to fund tax breaks for billionaires. There's obviously a lot to unpack here, and a lot of simultaneous battlefronts we are all facing. That is exactly the point. They are trying to keep us overwhelmed, fighting just to maintain our existing rights, and unable to advance while they actively roll society backwards to crush working people. But nurses know they must advocate beyond the bedside. And with that type of dedication, our movement doesn't have a reverse gear. That is why we are simultaneously fighting to keep ICE raids out of our hospitals and our communities, in the past 8 months of Trump 2.0, not for a single second, in our fight to win Medicare for all. In April of this year, hundreds of NNU nurses gathered in Washington, D.C. to let members of Congress know that cuts to public health programs would kill our patients. While we were there, we also stood with Representatives Pramila Jayapal and Debbie Dingell and Senator Bernie Sanders, who you just had here yesterday, for the release of the 2025 Medicare for All bill. Over 80% of Americans approve Medicare for All programs, yet we still do not have health care for all. Why? Greed. Union members are tired of negotiating away their pay at the bargaining table to pay for rising healthcare costs time and time again. We have the highest spending on healthcare out of all developed nations, yet we have the worst healthcare outcomes. Enough is enough. It is time for Medicare for all. In addition to the introduction of Medicare for All in DC, we also lobbied to advance legislation to make our workplaces safer, to protect the right to organize, and to ensure full collective bargaining rights for Veterans Affairs healthcare workers. On July 1st of this year, NNU mobilized in key districts all across the country, forcing members of the U.S. House and Senate to declare whether they stand on the side of patients and workers or on the side of profits when it comes to slashing $1 trillion from Medicare and Medicaid. And we all saw which side they're on, not ours. Nurses drew local and national media attention this National Day of Action, and although this deadly law eventually passed, we let representatives know that history would never forget how they voted on that terrible, deadly bill. We're also constantly taking action at the state level. I was just in Bakersfield, California with nurses, community, allies, and elected officials for a town hall on how to fight back against these attacks on our healthcare. That's how we do it, by coming together in a huge way, just like you all are here today. The billionaires know that when working people link arms in numbers too big to deny, our power completely diminishes theirs. That's why they will do anything to keep us divided, unhealthy, unstable, uninformed, and afraid. But are we going to allow that to happen? No! That's right. In the same way that our employers grow their profits by intentionally denying the health and safety needs of working people, the right is building their power by intentionally denying the humanity and history of entire communities. They ban books and curriculum chronicling how they and their predecessors were on the wrong side of history, putting profits above humanity. They have unleashed an all-out assault on higher education, withholding federal funding from institutions and research projects deemed too woke. They are arresting immigrant students for simply exercising their right to free speech. Union workers know our employers' playbook so well, including their use of intimidation tactics to deliberately chill organizing drives. This is exactly what's happening in our society right now. The Trump administration is trying to use fear to extinguish any movement to hold them accountable, but we're not going to let that happen. That's right. In the same way our bosses are constantly trying to divide and conquer working people by putting us against each other, this administration will go on national TV and lie about how certain groups of people are stealing from the public good. All false. Let's be real. All of their lying, revisionist history, and fear-mongering is a calculated power grab. And that's why it is so important for working people to not let them control the narrative. We must keep speaking up, keep showing up, including at their offices and at the ballot box when we kick them out of office. Even if we have to use creative techniques to address their attempts to redistrict and rig the midterms, we're going to do it. In addition to their onslaught of takeaways, we can see this administration and their billionaire buddies trying to restructure the government, trying to make the U.S. workforce as precarious as possible and replace as much of us as possible. But we are not going to allow that to happen, are we? No. They're even trying to strip protected union rights from federal workers, including from 15,000 of our Veterans Affairs nurses. That's right, and they're continuing to fight back. Those nurses are not going to give up. Just because they took away contract doesn't mean they took away our union. It's our collective power.
That's right.
We all know the truth. The VA is the largest public health system in this country that works because of the nurses and the healthcare workers who are dedicated, which is exactly why they want to privatize it for profit. They're trying to destroy public institutions, including the VA, so they can say, these services don't work. That's why we have to privatize it. All false narratives. As a movement dedicated to people over profits, we cannot let this administration destroy our public institutions.
That's right.
We have to keep moving forward. We must grow our numbers and organize like never before because we have the people and we have the power. In recent years, we've been so proud to see historic strikes and organizing campaigns among nurses and other workforces like you all. From 2020 until today, NMU has added around 55,000 nurses to our ranks. As we continue to get more unified and organized, NNU, UE, and our allies must continue moving forward towards the future we know all working class people deserve. When they try to knock us back with lies, we will be right there to advance the truth.
Hell yeah!
That's right. When they hit us with takeaways or efforts to privatize public goods, we will draw on our shared track record of not compromising with management, and we will win. One voice, one fight, one future is your convention theme, and that's exactly how we are going to navigate this dangerous time together as one. It is possible to achieve a tomorrow where care is the driving force, not death and destruction. Union workers know this is true because we are already living it. Because when we fight,
we win.
When we fight,
we win.
That's right. Thank you, everyone.